Hi everyone, welcome back to the Vision Refocus channel. Our goal here is to explain how various ocular diseases affect your vision, as well as provide actionable steps to keep your eyes healthy. I'm Dr. Kevin Cornwell, and today we're going to be discussing traumatic optic neuropathy, what it is, how it occurs, and whether or not there's anything you can do to improve your vision after an injury or a traumatic event. Let's get started. Alright, so traumatic optic neuropathy, also known as TON, can occur when there's damage to our optic nerve following direct or indirect blunt trauma to the eyes. TON is a relatively rare cause of vision loss and occurs in approximately 1 to 2% of people following a traumatic incident. Think motor vehicle accidents, sports-related injuries, assaults and domestic violence, accidental falls, or combat-related head injuries. Before we continue, I wanted to take a second and explain what the optic nerve is, as this is the part of the eye affected by TON. Basically, the optic nerve is the connection from our eye to our brain, and it's made up of little tiny bundles of cables we call axons. These little tiny cables are responsible for transmitting our peripheral and our central vision from our eye to our brain. Looking at the optic nerve head-on, it looks like an orange yellowish colored donut. And where it enters the eye, it makes up what we refer to as our physiologic blind spot. We never really notice this because we usually have both eyes open. When the optic nerve is affected by a disease or from trauma, vision loss can be highly variable. Some patients may be completely asymptomatic and have 20/20 vision. Other times, patients can have no light perception and complete blindness in that eye. Many conditions can affect the optic nerve, including glaucoma, alcohol and substance abuse, birth defects, and trauma, as well as many neurological conditions such as strokes, multiple sclerosis, or brain tumors. Okay, so back to blunt trauma. When a traumatic injury occurs to the eyes or head, those little optic nerve cables are highly susceptible to damage. When an injury is severe enough, deformative stress is transmitted directly to the optic canal. This is the part of our skull that the optic nerve passes through on the way to the brain. Swelling and loss of blood flow can also occur, causing a portion of the optic nerve to die off and no longer function properly. When this occurs, the optic nerve develops a pale white appearance in the affected section. This clinical finding happens usually around 6 weeks after an injury. And depending on which part of the optic nerve that's affected, this will determine how symptomatic patients are for changes with their vision. Sometimes patients are completely asymptomatic. This is usually the case when there's just subtle peripheral vision changes. However, when central vision is involved, patients tend to be highly aware that there's a problem with their vision. So when it comes to symptoms of TON, most patients will experience new blind spots or shadows in their peripheral vision, or the sensation of staring through a window screen. Visual changes with TON can be highly variable and usually occur within days to weeks of an injury. About half of patients with TON will experience some form of severe vision loss. These patients may also notice significant compromises to their depth perception and color vision as well. Unless both eyes are affected, most patients will still be able to perform their daily activities without an issue. In situations where the bones of the orbit have been fractured, patients may experience double vision due to entrapment of the muscles around the eye. Loss of facial sensation and numbness on that side of the face can also occur as well. The floor of the orbit is the weakest bone and tends to fracture first in cases of trauma. In these cases, patients may find it difficult to look up in the affected eye, and with both eyes open, will notice an increase in double vision on upward gaze. Various treatment options have been explored for TON, including high-dose steroids and surgical decompression. However, at this time, due to the lack of randomized control trials and an increased risk for side effects with these treatments, most eye care providers today opt for a more conservative approach and will tend to just monitor these patients over time for changes with their vision. The International Optic Nerve Trauma Study even showed that observation alone had similar visual outcomes to other treatment modalities. So unfortunately, at this time, there are no standard of care treatment options for TON. Visual recovery after TON is highly determined by what the patient's vision was immediately after the injury. Up to 60% of TON patients will recover some vision. Usually, if vision is still satisfactory days after a traumatic event, there should be little concern for TON and vision loss. However, patients who've lost consciousness or those who do not recover their vision within 48 hours after an injury, these people tend to have worse long-term visual outcomes. Patients who have any new symptoms of double vision after a traumatic injury should have neuroimaging performed to rule out orbital fractures or muscle entrapment. And if present, surgical intervention may be necessary. Oftentimes, TON patients enter the healthcare system through the emergency department and will usually already have had neuroimaging performed. Also, for patients who have large residual blind spots in their vision, they may benefit from an evaluation with a low vision specialist. These are typically optometrists who have access to various custom visual aids such as magnifiers or telescopes to help patients better use their remaining vision. And lastly, I just wanted to say that with any of the previous symptoms that we've discussed here, it's important to have a comprehensive eye exam with visual field testing. Other parts of the eye can also be affected by trauma, primarily the retina. So it's important to rule out tears and detachments to the layers of the back of the eye with a dilated retinal exam as well. So there you have it. I hope you found this video informative and now have a better understanding of how trauma can affect your eyes and vision. If you have any further questions, feel free to leave them in the comment section below and I'll get back to you. For more videos on ocular disease, along with actionable steps on keeping your eyes healthy, check out the other videos on our channel and consider hitting that subscription button. We are coming out with monthly videos in English and Spanish, so stay tuned. Thanks again for watching, and we'll see you in the next video.